So coming back, shifting gears a little bit, moving away from lentigo melanoma, and we touched a little bit about the pink nodules. Those are pink melanomas. Those are very, very difficult to diagnose. We talked about lentigo melanoma on the face, are very difficult to diagnose. We talked about the pink lesion to be very difficult to diagnose. Are there any other difficult lesions, like acral side, nail side, or any other body side that's difficult?
So the other type of melanomas we have are what are called acral lentiginous melanomas, melanomas on the soles. And those melanomas are also difficult to diagnose. They too have a distinct pattern dermoscopically. We see that in individuals who have much darker pigment. And it's very, very important to realize that individuals with very dark pigment, individuals who are Fitzpatrick 5 or 6, these individuals, it's very important to look at the bottom of their feet because this is where they get melanomas. It's the most common melanoma that we see in those types of individuals. In fact, in Mexico, it's the most common melanoma is an acrolentiginous melanoma, which is surprising to me. And it's also difficult to diagnose not only clinically because with very, very dark skin, some individuals have numerous brown patches of skin on the bottom of their feet, and you scratch your head because is this just normal for this individual, or could this be a melanoma blending in with these other areas of just flat brown patches of skin? And dermoscopically, it's difficult as well because a large percent of these don't have the classic dermoscopic pattern of we call the parallel ridge pattern.
So what about confocal? I guess confocal cannot reach because the epidermis is too thick.
It's too thick. Yeah, and also the machine is too big.
Yeah.
That is, there are two types of confocal. There's a handheld, but you're only looking at almost a millimeter area of skin. It's like doing a 1 millimeter punch biopsy for a big lesion. Okay, you're not going to get much because when we look at pathology, when we look at confocal microscopy, we're looking at the overall pattern. And in order to really evaluate lesions, we need to have the entire architectural pattern.
So shifting gears a little bit. So everything we talked about, the acral lesion, everything talked about, this is mainly for people who, the difficulty is for people who are Hispanic origin,
Yes.
African American,
Asian.
and Asian, exactly. And of course that we have to include that Caucasians also can get those melanoma on the bottom.
They can.
But exactly like you said, because a lot of those, Asians, Hispanics, and African American, they can have those benign pigmentations, right? And that's what's sort of making it difficult to tell what is a real melanoma versus just benign pigmentations, basically.
Correct.